Finding a new health plan can be challenging. ACA plans, deductibles, in-network, exclusions, pre-authorization. What does it all mean? We have tips to help you shop on this episode of the Texas Insurance Podcast. Hi everyone, I'm Misty Highnote. Today we're talking with TDI's Rachel Bowden about what to look for when buying a health plan. If you find this information useful, please like and subscribe to the Texas Insurance Podcast and share it with your friends and family. Well, thanks, Rachel, for joining us today. Appreciate you being here.
Happy to be here.
All right, so let's talk about health insurance. So how does someone get health insurance?
Well, there's two main ways that people get health coverage. The main way people usually get health coverage is through their job. Sometimes it's their job, or sometimes it's their spouse's plan or their parents' plan. And if you're covered under your parents' plan, you can stay covered until you turn 26. So even if you're not in college, even if you're not living at home, and even if you're not covered as like a dependent on your parents' taxes, you can stay on their coverage. The second way that people get coverage is buying their own plan. So if you don't have a good coverage through work, look at healthcare.gov. That's the main place that people go into the individual marketplace to find coverage. You could also buy directly from a health insurance company, but if you want a premium tax credit, healthcare.gov is where you need to go.
Okay. So what tips do you have for choosing a health plan?
Mainly you want to see, is the plan going to cover what you need it to cover? Since the Affordable Care Act, most plans generally cover the same things. They just cover it in different ways. So what might be called ACA or Obamacare coverage, that's for the Affordable Care Act. And that just shows that it's a major medical or comprehensive plan that's going to cover pretty much everything that's medically necessary. When you look at the plan, one of the things to look at is the summary of benefits and coverage. And that's a standardized document that should make it easy to compare one plan to another in a pretty standard way. And it'll cover, what services are covered and what limitations might apply. So if there's specific healthcare needs that you have that you want to make sure are covered, make sure to look at what the limitations and exclusions are. So a common type of limitation is an HMO and an EPO plan only cover care that's covered through their network providers. So you can't choose any provider. You need to make sure your doctor is in the network. Whereas in a PPO plan, you might have more choices. Other common limitations are that you need to do pre-authorization to make sure it's medically necessary before it's covered. And then, of course, major medical plans don't typically cover, glasses or dental care, but some might, or you can buy a separate plan for that. But major medical plans are pretty comprehensive. So the first thing to look at really is this a major medical plan, or is it a more limited plan? Because those are out there. The other big thing you want to look at when choosing a plan is the network of providers. So if you're going to have to use the network, you want to make sure it covers your doctor. Is your doctor in the network? Maybe you're willing to change doctors, maybe you're not. So that's definitely something to look at. And healthcare.gov actually lets you put the name of your doctor in to see which plans might include your doctor in the network. The other thing you want to look at is if you're taking any prescription drugs, you want to look at they call it the formulary, and that's just the list of drugs that the plan covers. Both the formulary and the network can change, especially when the plan renews. That's when your formulary will change. And so even if you've been on a plan a while, you want to look at that each year and make sure that your same coverage is still gonna be there. So I think those are the main things to look at.
Okay, those are some great tips. And when we talked about doctor, you want to check your specialist too, right? If you have a cardiologist you see every 6 months, you want to check them out too, right? In addition to your PCP.
Absolutely. It's also good to know which hospitals in your area are covered, which urgent cares are covered. If there's, places that you typically go or someone in your family goes, you want to check all of those providers.
Right. Okay. So what tips for affordable health care? We know we're all looking at our pocketbooks.
Absolutely. I mean, the big headline, right, is the premium, the monthly cost that you're going to pay. And in an employer plan, that's usually pretty straightforward. Mm-hmm. Oftentimes the employer will, pay part of the premium so your cost is lower. They might pay part of the premium for your spouse or your dependents. If you're buying on healthcare.gov, your premium will depend on how much money you make. So having a good estimate of your income for the year is how you'll find out what amount you'll qualify for a premium tax credit. And almost all people who buy coverage on healthcare.gov do qualify for a premium tax credit. So putting that information in when you first start shopping is going to give you the best idea of how much the premium will actually be for your family for that year. After you look at how much the premium is going to cost you, you're going to want to look at the out-of-pocket costs.
Okay.
So that'll vary a lot plan to plan. There's lots of different, some plans have no deductible, some plans have a high deductible. It's a good idea to understand how much are you going to pay when you go to the doctor, when you go to the specialist, if you have to go to urgent care or an emergency room. And is there a deductible? So if it's a high deductible plan, one thing that I really recommend looking at is what does the plan cover before the deductible? So the Affordable Care Act requires all plans to cover preventive care before you reach your deductible. So that means you can have an annual checkup, your kids can get their vaccines before school, all kind of that normal preventive care. But what if they get sick? How much are you going to pay to take them to their primary care doctor, for an ear infection? Mm-hmm. So some plans will cover primary care for free or for a copay even before the deductible, and some plans won't. Some plans might cover like virtual visits, like telemedicine, before the deductible as well. So with high deductible plans, I feel like that's a really good detail to look at that might be a differentiator between different plans that might have a similar premium on similar deductible.
Right. Yeah, those are great tips. So what about spotting potential problems? How can a consumer spot potential problems when they're shopping for health plans?
The big red flag is pressure to buy now. Okay. There are no sales in health insurance. The price is the price. You do have to understand what the open enrollment period is, but no one should be pressuring you to buy something without seeing the fine print. That summary of benefits and coverage is your first entry point to the fine print. And even from there, you should be able to see the whole policy that's going to detail all the coverage, all the exclusions. You should have time to look at that network and that formulary. You shouldn't be pressured to buy without seeing those things. Usually that type of high pressure sales tactics is not happening with major medical coverage. It's happening with the more limited benefit plans. Those plans might be right for some people in some situations, but if you're looking for major medical coverage, that's what you need. You don't need an accident-only policy combined with a specified disease policy. These are limited types of coverage that most people don't need and that aren't the same as major medical coverage. One of the big things with those plans is they're not going to cover pre-existing conditions. They'll ask you all of your medical history information, and you might not qualify if you have a pre-existing condition. One of the things I think people don't understand is even if they do qualify, they say, hey, I have diabetes, and then they tell me what the price is, and they say I can be covered. Yeah, they didn't deny your coverage, but that doesn't mean that they're going to cover your insulin. They're going to exclude your diabetes, right? That's what a pre-existing condition exclusion means. And, with the Affordable Care Act, there's lots of available options that do cover pre-existing conditions. So you want to just be aware that there are other types of plans out there, and how to make sure you're getting the coverage that you want. One of the red flags is definitely if someone's asking you for your personal information, right? If you maybe you shop online and you enter your phone number and you start getting a lot of phone calls. First, just don't enter your information online so you avoid all those phone calls. But if you are on the phone, you shouldn't be giving out your personal information. You don't want to be giving out your credit card information. Really signing up through a trusted website like healthcare.gov or, directly through an insurance company. That's where you want to be entering your information, not to, someone over the phone.
So you mentioned open enrollment. What is that? Tell us what that is.
Open enrollment is the time each year that you get to sign up for coverage. So if you're signing up through your employer plan, that could happen any time of the year. It's often January, but not always, or a few months before January. If you're signing up on healthcare.gov, the open enrollment period will start November 1st and end January 15th. Of course, if you want your coverage to start on January 1, you really need to sign up by December 15th. So those are the only deadlines that apply when you're buying your own coverage.
Okay. Are there other times throughout the year that we can buy coverage on healthcare.gov?
Yeah, so there's special enrollment periods. Those really apply when you're through your employer plans as well as your individual plans. And those cover situations like you have a baby. Of course, you get to add the baby to your coverage. You get married. Maybe you switch to a spouse's plan. You might move to a different area where your insurance isn't available in that new area, or a different state, a different county. Sometimes income changes that say you previously didn't qualify for a tax credit and now you do. Those things could also qualify you for a special enrollment period.
Okay. So there's other times we can sign up. That's good to know. Okay. So this is all some great information. If we need just a little bit more help, what kind of resources would you recommend?
So healthcare.gov is a great resource if you're looking for coverage. They'll tell you more details about those special enrollment periods and let you check how much you might qualify for on a premium tax credit. And TDI's website is a great resource. We have a lot of these shopping tips in more detail. We have checklists and more information on our website.
Okay, great. Well, thank you so much for this information. We're going to go home and digest it and be ready for open enrollment. For more information on health insurance scams, watch this video. And if you have questions about health insurance, call our helpline or visit our website. Thanks for joining us. We'll talk to you next time.